I have neck pain. The pain radiates to the shoulders up to the head. The pain is severe, interfering with my life, with my daily activities, even interfering with my sleep. I went to a doctor, he examined me, he did an x-ray of the neck and he did MRI of the neck and told me everything is normal. There is no disc. Now I'm confused. Why? And why do I have this pain? This was a question from one of our followers. Let's talk today about cervical facet pain syndrome, or the pain generator would be the cervical facet joints. This is the spine, and we have, those are the joints, they're called the facet joints. They extend the length of the spine. Typically they hold the weight of the spine if it's in the neck or of the lower back. They are true joints that are flexible with a capsule around them. So you can have inflammation of this joint, you can have arthritis of the joint, or you can have hypertrophy of the joint where the joint becomes thicker. That can produce pain over the joint area. And of course, there are covered by layers of muscle, so you can have also muscle spasms. So patients typically complain of neck pain if we're talking about the neck area. Neck pain radiating to the shoulder, at times radiating into the head, a lot worse with activity, at times interferes with the sleep. Even it can extend to be causing headaches, causing vertigo, causing dizziness, or even tinnitus. So the diagnosis is based on the clinical history and physical examination and not the imaging. So you can do an x-ray, might not show anything. You can do an MRI of the cervical spine, will not show anything. Especially sometimes radiologists might not pay attention to pathologies in these joints and not mention them on the report. So the diagnosis is based on the physical examination. When you palpate those muscles, the patient will have, or over the joints, they will have severe tenderness. They usually will have also limitation in range of motion if it is side bending or if it is rotational movement. So the treatment will begin stepwise. We begin with simple steps. We use muscle relaxant. We use anti-inflammatory like ibuprofen, diclofenac, naproxen, and we put the patient through physical therapy and massage therapy. This usually will help. Now, we also ask the patient to modify their lifestyle. We ask the patient what they do during the day or during their life that trigger this pain. It could be working too much on the computer, or using the phone too much, or any other jobs, or sometimes they might not have any reason for it, or it can be also after a car accident. So if they modify their activity, that helps the pain not to come back. Also, we always advise the patient that they should go to the gym, they should exercise, they should strengthen the neck muscles, and that will prevent the symptoms from coming back. Now, if these steps fail, then we move to the next step, which is the intervention. We inject the facet joints either with steroids and lidocaine or anesthetic, or we inject them with a platelet-rich plasma, which I prefer. So platelet-rich plasma, we under fluoroscopy, we go in the joints and we inject the joints and we inject the muscle. We typically do it once, however, it can be repeated twice, and that should take care of the pain for years to come. And we emphasize that the patient should they modify their lifestyle and they exercise. Thank you.